What are the steps to be followed for general management of poisoning? The following concepts are central to approaching a toxicosis patient. 1. Ensure airway so that breathing and circulation are adequate. Remove unabsorbed material. Limit the further absorption of toxicant. Hasten toxicant elimination. The initial survey should always be directed at the assessment of and correction of the life-threatening problems if present. Attention must be paid to the airways, breathing, circulation, and central nervous system. Question 2. Define the term envenomation. Envenomation is the infusion of venom into another creature by the means of biting or stinging it. Question 3. What are principal lines of treatment? Principal lines of treatment include decontamination, emesis, and symptomatic line of treatment. Question. What is decontamination? Decontamination refers to skin or eye decontamination, gut evacuation, and administration of activated charcoal. Question. What are methods used to increase elimination of poisons from the body? The following methods are used to increase elimination of poisons from the body, that is urinary alkalization, multiple dose activated charcoal, extracorporeal techniques, and diaphoresis. Question. Which chelating agent is recommended for acute lead poisoning with signs of encephalopathy? Dimercaprol plus calcium EDTA. Question. How does carbon monoxide cause normal appearing or pink colored skin? Carbon monoxide causes normal appearing or pink colored skin due to its ability to increase hemoglobin's affinity for oxygen, resulting in hyperoxygenated red blood cells. Analytic toxicology is important for the qualitative and or quantitative estimation of chemicals that may exert adverse effect on living organisms. Forensic toxicology involves the use of toxicology for the purposes of the law. By far so, the most common application is to identify any chemical that may serve as a causative agent in inflicting death or injury on humans or in causing damage to property. Clinical toxicology encompasses the expertise in the specialist of medical toxicology, applied toxicology. The toxicologic investigation of a poison death involves first obtaining the case history in as much detail as possible and gathering suitable specimens. Second, conducting suitable toxicological analysis based on the available specimens. And third, the interpretation of the analytical findings. Important components of the initial clinical encounter with a poisoned patient include stabilization of the patient, clinical evaluation, which involves history, physical laboratory, and radiology, prevention of further toxin absorption, enhancement of toxic elimination, administration of antidote, and supportive care with clinical. The toxicologist, as an expert witness, may provide two objectives: testimony and opinion. Objective testimony usually involves a descriptive of analytic methods and findings. When a toxicologist testifies as to the interpretation of analytical results, that the toxicologist is offering an opinion of the follow-up. Question. What are the objectives of analytical toxicology? Analytical toxicology is aimed at to provide support to clinical toxicology. In brief, clinical toxicology includes DIMPLE, which means diagnosis, identification of poisons, management and treatment of poisoning, prognosis, law enforcement, education and research. All the 6 indications mentioned above are be remembered by the mnemonic DIMPLE. Question: what are general precautions to be followed by any investigator in toxicology laboratory? So, strong acids or alkalis should always be added to water and not vice versa. Strong acids and alkalis should never be preserved together. Organic solvent should not be heated over a naked flame but in water bath. Use fume cup use fuming cupboards or fuming hoods when organic solvents are heated.